Okay, so we are in lecture 2 of the measurement and evaluation class, DSW 942. And so for this week, we'll be looking at measurement. We'll be looking at, let me go to the next screen. We'll be looking at ethical considerations and challenges in measurement. We had looked at this before. We had looked at the introduction and other aspects of it before. So, well, who are those who were not in the first class? Are there people who were not in the first class that are here today? Let me see the attendance list. Magnus, are you here today? I can't see the screen to see who's there. Is Magnus here? Onasoku, can you guys mute and let me know who's here?
I'm here, sir. I was here last week. I'm here today, sir.
Last week. Okay, thanks. Yeah, Bridget. Shadrach, you were here last week. Excuse me. Okay. So in any case, I'll just proceed. Okay. So this class will be considering ethical considerations and challenges in measurement and social work. As a general thought, to kind of introduce us to the ethical consideration module for this class, I'd want to note a few things, because again, I want to go back to what social work is. And then from there, we begin to look at the different considerations of on the ethics involved in social work, especially when you have to do measurements and those considerations cut across all kinds of things, not just social work, but let's focus it on social work. Social work is a discipline and profession, and is deeply committed to principles of social justice, equity, and the well-being of individuals and communities. So measurement, whether for client outcomes, program success, or community needs, plays a critical or crucial role in guiding practices and research. However, the act of measurement in social work is fraught, that means it's burdened with ethical considerations and practical challenges. So for us in this lecture, we're going to be exploring these complexities, emphasizing the importance and ethical vigilance and methodologies, and then the work, the rigor that it takes to do this thing. So on your screen, you will find that I have ethical considerations. The first is informed consent. In the last lecture, I spoke about informed consent. And so here, we're going to be looking at what it is when we say informed consent. You have 3 bullets I put in here. Social workers must ensure that all participants understand the purpose, procedures, risk, and benefits of any measurement activity. So you don't just wake up and say you want to measure something. So you must understand what you are trying to measure, and then also look at the risk. A risk to the client. The risk is to the client, which you must always consider. You also need to be sure that the consent that you are getting is freely obtained without any coercion or undue influence. In other words, when you're trying to get consent to continue with your research or your measurement, What you do first is let whoever is responsible in the area know that you need to get to perform these activities. You need to evaluate this, or you need to measure how things are going, and so on. So what you do is you get their consent. They agree. And how do you get their consent? You first notify them officially. Don't just go verbally. You notify them officially and then they give you request a response in writing. And then you keep that. Then when you now go to talk to the individual persons, you must also get their consent to be able to discuss with them, interview them, or elicit information from them. You have a consent form. So you must have developed a consent form which captures all the things you want to do and so on, separate from the one that you submit to the organization. You know, for example, if you want to do a research in Nigeria, you want to do a research in Nigeria that has to do with human subjects or wherever, you would have to get approval from government. So you need to submit your research proposal and protocols to the authorizing body. And in your research proposal and the protocol, you will state what you require, what you're going to get, and all of that, and what information you want to get from participants, if they are individuals. How invasive is that information? How invasive is that thing that you want to get from them, especially when it has to do with human subjects? Are you going to be collecting blood samples? There are certain specifications that you have to follow to get consent. Are you going to just be collecting information generally, which does not have to go through those invasive approaches? Then yes, there are also certain procedures, and those ones are lighter in terms of requirement. And once you submit that, then when you go to the person, you also have a separate one sheet of paper that it says consent form, consent to be interviewed. If the interview is going to be by recording, consent to allow for recording. If you're going to take pictures, consent to allow pictures to be taken, and consent to allow your picture to be used in a report or publication. So all that has to be done and done well in preparation for the activity. So special attention is required when working with vulnerable populations, which is most of the population that social workers work with, such as children, older adults, individuals with cognitive impairment. So you need to be able to get their consent, and in the right way. Because when somebody sees their picture or somebody sees their relative's picture, it may be a child. I'll give you an example. When I was working in Nigeria, a private school where I sent my kids to decided to take pictures of the children. They did not tell the children or the parents what they're using these pictures for. What I realized was that my daughter was 9 years old at the time. My daughter said she's not taking that picture. And it created a big scene. And the principal or the proprietor wanted to flog my daughter. My daughter seized the cane, 9 years old, seized the cane from the teacher and said, I don't want to take pictures for them. And the case was brought to me in my office. So my wife brought, I called I asked my daughter, what's the problem? He said they want to take pictures, they want to use for advertisement, and she doesn't want to be part of it. And I was surprised, first, that she is able to have that ability to say no and understand that it's an advertisement, and we parents were not notified. So I went to the school, and I asked, the proprietor wasn't in, the assistant head teacher was now there, and I asked him, I said, what's the issue? He started saying, oh, they're taking pictures. I said, no. If a child doesn't want to take a picture, you don't force that child, because my daughter may go to that picture and frown her face, and whatever I want to use it for would be wrong. I said, but why don't you also tell parents that you are taking pictures of their children? What are these pictures going to be used for? He said, well, we just want to document pictures of our students. And I said, but we still need to know. A few days later, I went, those who were in Abuja would know, I went to Grand Square to go and buy things. And what do I see? My son's picture with two other kids put on a notice board, put by the wall of the school, of the shop, Grand Square, advertising the school. And there's my son's picture. My son didn't know. My son is at that time was quiet and a conformist. My daughter was rather on the other side of the spectrum. And so I went to the school and said, why did you people do this? You didn't write to us. You didn't notify us. So I request that you pull that down immediately. If not, I will sue you. And that's how they took the picture out. So consent is very essential because a relative of the person, a child, may decide to sue you, and then all your work will now be will be cancelled because you didn't obtain the appropriate consent. So consent is a very important aspect. Another one is confidentiality and privacy. Safeguarding clients' personal information is essential. Data collection during measurement must be stored securely and shared only with authorized individuals. First, when you're collecting data information, especially personal data information, it is best to use a code to represent a client that only you know or your office knows that this code means Janet or Lamisakon or whatever. And so Janet or Lamisakon's name should not be put on the register, on the thing. Because these days people hack. People hack a lot, and they may hack your system and pull out this data like it's happening here in the US. They hack it and they sell the information. Social security numbers, for example, they could hack information and get your BVN, your NIN, and things, and use it to fake that they're the ones who own those numbers, and then begin to use it for nefarious activities. So you have to be sure that your privacy or the patient's privacy is fully guarded. You use code so nobody can relate it to them. Somebody who's not part of that study cannot relate it to the person. You must comply with laws and policies. For example, in the US here, there are certain laws that are specific to protect data and also protect the clients that you're working with. I tried to find out those laws in Nigeria, but I couldn't. But I give you an assignment. Maybe somebody can find out what are those laws that protects the client. I know that in research, the National Council of National Council for Research and something has that, but that is not national. It's just specific for you doing a research that you submit to them. So does the government have something that is specific that safeguards people's, or do individuals like banks and so on have specific regulations that safeguard their own information and the personal information of their clients? So we need to know that and maybe have a more broad thing that would also prescribe penalties for using something, information that you got nefariously to do things without proper procedures. And when reporting results, anonymized, I just mentioned this, anonymized techniques should be used to prevent identification of the individual. So like I said, you provide numbers, a combination of numbers that will reflect somebody. You can agree from the beginning that we will use a combination of people's names, but then people have same names. If you say want to use a combination of people's initials, well, many people may have the same initials on that study group or your client pool. Many people have the same initials. So what do you do? So you have to find a code that will be ideal and unique for somebody and use that to record your data. And when you're presenting, you use that code to present it. We did that when we set up the what do you call it, the dashboard for Ministry of Health for fistula. And this could be used for other considerations in Nigeria. So the Nigerian government now has that, Federal Ministry of Health has that program that we developed, and how you can, from working at getting clients and things, including a client's BVN and all of that, how you can now use a code to identify that client. And once that code is entered into the system by the authorized person, the client information comes up. So avoidance of harm. In all we do, there is a need to avoid harming our clients. Whether you're a school teacher, a medical professional, or I don't want to use soldier because a soldier doesn't have clients, but a peacekeeper and so on, you must always think about what harm you're going to cause on your client if you do something wrong. So in medicine, there's a Hippocratic law oath that you take. There's a do no harm oath. Do no harm, that you must not cause harm to. So if you're coming to treat somebody, let that treatment you're providing not cause another harm to the person. So you must consider all of those aspects. So measurement processes should not inflict psychological, emotional, or physical harm on a participant, on your client in this case. Questions or assessments that may re-traumatize or stigmatize the individual must be designed with sensitivity and, where possible, avoided. So you don't go counseling somebody and then in the process assigning blame. That is somebody who is already traumatized and you come in and assign blame. It happens a lot in hospitals, especially nurses that are not fully sensitive, especially nurses in the delivery room. When a patient comes in and is in labor, and labor is being prolonged, and they are screaming at the patient to push, this patient is already traumatized over the period. And instead of managing and having a subtle way to support and help her to gather the energy to push, you are screaming at her. When you are enjoying yourself and got pregnant, was I there? Push, please. So you are re-traumatizing this lady for the act of being pregnant when she is in the process of giving birth. So we need to be able to avoid those kinds of things. And researchers and practitioners should be aware of power dynamics and mitigate any adverse effect resulting from participation. Remember that you, as a social worker, coming to a vulnerable person, you are coming from a position of power, because the person looks up to you as somebody who would help. And therefore, whatever you say comes with the weight of your office or of your position, the weight in power of the power. And so that person will tend to either succumb. So if you come with a harsh tone, the person will quietly recoil and may not provide you the necessary information because they're afraid. So you have to remember that no matter how big the person is, it is always important to know that once somebody is vulnerable, that person is in the position of less power. If you find somebody that is a commissioner of health and who has power and everything, but then the commissioner gets sick and he has a serious illness, like say he's a male person that has prostate issues, cannot pass urine, and comes to the urologist to come at them in that state, at that point in time, the urologist has more power. The urologist has more power. And so it doesn't matter that the Commissioner for Health is in charge of all the people in the state. But when he's sick and has urological problems, then he has to go see a urologist. At that point in time, urologist has more power. Now, the urologist cannot say, because I have the power, I have to show this person. After all, commissioner is not approving things that we should do. So you need to always look at it from there. As social workers, remember that you are in a position of power as it relates to your client. Another thing people do is you want to talk to your client. Your client is sitting down and you are standing up, looking down on your client. So that power that you have is already exacerbated by the difference in height of your communication. So you're talking down. So the best thing to always do is get a seat, sit to have eye level contact with the eye of your partner, of your client. And that helps to make the partner not look up to you besides training, but it looks as if she's or he or she is in a beggarly position looking up to you. So you always have to remember that. Even when you are in your office and you're talking to your subordinates, except and unless you are doing a lecture on the board, it is always good to sit down. I let your subordinate also sit down and have a discussion with them eye to eye. It is always a good thing, not you standing or them sitting down and you recline. I mean, them standing up and you reclining and they're sitting down talking to you as human beings. No. So the power dynamics may change at that point in time. So it's always good to remember that. That's all. Cultural sensitivities. Well, we all are in a situation of we are in an environment where culture is very different. As you go, for every mile you take in Nigeria, you have a different culture or a different perspective or a different way of looking at things. So you have to look at the competence and sensitivity of yourself and your colleagues as you begin to go out to collect things from a community or a group of people, or even with one person. So you need to look at the tools that you are developing. The tools that you develop must be contextual. It must be contextual. So that people that you are administering these tools on will understand it because it is based on their context. You know, I don't know most of the deep Yoruba languages, but I know some in Igbo and things. But I know a few in Yoruba. For example, in Yoruba language, there is a way you will talk about something that has the word Ogun, Ogun, Ogun. And if you are not sensitive to the context in which it is used, you may relate a different meaning. And so somebody that you're asking questions and trying to fill out the two will provide you with a different meaning. The same also in Igbo language. You have aqua, 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 same spelling, aqua, but different pronunciations, different inflection points. That gives it a different meaning. Aqua is cry. Aqua is cloth. Aqua is egg. Aqua is bed. So you need to understand those contexts and things so that you can properly understand. That's why they say when you're going to interview people, use somebody from that area who understands the nuances and things. So be able to know which word to use so that you won't be like Reverend Father, who went to a class and was making a preaching, but putting the inflection on a word that people understood differently. Power, Ike, and is different in a different context. And so he was using it in a different context instead of what it means as power because of where the inflection point was added or where he placed the inflection point. And so the church was smiling and he was busy thinking he was doing great. So that's very, very cultural sensitivity. Also, you need to be sensitive to communities where it is only a female that can collect data from a female. You know, social workers should avoid ethnocentric biases and ensure that assessment respects clients' backgrounds and experiences. When you come with preconceived notions or preconceived biases about a group of people, then it affects the way you collect data from them and the result that you're going to get. It will affect that. So you need to avoid that. You need to understand that, those sensitivities. And like I was mentioning, translation, adaptation, validation, measurement tools may be necessary for diverse populations. So you have to find somebody who knows, understands the place to review that through and look at the words to be sure you're translating them properly so that it doesn't cause problems for you. Transparency and honesty. They said anybody who comes to equity must come with clean hands. If you're coming to conduct a research, you must be very transparent. Why am I saying this? Because people know that they have been used for ulterior purposes. Also, the data you're collecting and the reactions that you're presenting also may affect the way people perceive you. In those days, in the 90s, early 90s, when we were working on HIV/AIDS and things, we were conducting training on using television to using video to modify behaviors and so on. And so we go to a community. We had some foreigners who came with us. We go to a community to take pictures and talk to the people. We get consent to talk to the people. However, one of the foreigners who was there was busy taking pictures of the drainage system with all the dirt and things filled up in the drainage system. And I turned and said, why are you taking that picture? The community didn't give us approval to take that picture. Because people want to use that to go and show that where they went to, the people are so dirty, the people are this and so on, which is not what we went there for. So everybody must understand that when we are collecting data and things, we need to be transparent. And also what we are collecting data for is what we will use for the research or evaluation or whatever it is we are doing, not other data that we collect and go and write publication, sell to the newspaper and things for them to take up and publish. You know, so that's very essential. Now there's another aspect that we'll look at. When you look at ethical considerations, there are challenges. That's what we will look at, the challenges in measurement in social work. Complexity of social work makes it a phenomenon because it's always morphing, it's always changing because human experience and social environments are multifaceted, they're different. They always change from one place to the other or individually based on emotions. So when you're dealing with human beings, you're dealing with a variety of issues that you have to consider because those things make it difficult to capture them fully with standardized measurement. So you can't say every morning we have to capture this data from these people because when people wake up in the morning, they are very alert and they are this and so on. Well, hello. Sometimes some people wake up in the morning and you say good morning, say what's good about the morning? Because they woke up on the wrong side of the bed. By wrong side of the bed, meaning they were angry when they're sleeping or whatever, or they may have had a nasty dream that making them scared. So you have to take into account those differences. Sometimes you may decide to come back a different time to take that, or you may take a series of measurements and then be able to compute the average to decide what really is the condition, giving the occurrences, the mean, the mode, and all that. Variables such as trauma, resilience, or community connections may not be easily quantifiable. How can you quantify somebody's feeling about an issue that involves them? How do you quantify that? It's difficult. And so you have to find a way to be able to either find scores to be able to address it. Like when you go and the doctor asks you, if you say you're feeling pain on your knee, and the doctor says, how? You say, oh, it's aching very much. They give you a score. So, okay, from 1 to 10, how would you rate your score? You say, I rate it 5. Okay, so that's average. But then when the doctor touches, that's almost 9. That is almost 9. So you need to find a way how best to collect your information that you can easily quantify, or that will help you pull and get closest to what it is required to take. Okay. Then also reliability and validity. The tool must consistently produce accurate results, reliability, and truly reflect what they are intended to measure. That's validity. If you intend to measure something and it's reflective of that which you are measuring, then that is valid. And how accurate it is makes it reliable. So, but it all also depends on the tools you develop to measure what it is you're going to be measuring. Because if you don't develop a tool that is sensitive enough, then it may not be reliable. You may not develop the right data that you want as accurate as possible. So your tools, that's why we say in first place, sensitivity of the tools is very essential, And then if you're not testing adequately, especially in cultural setting, you may be compromising both reliability and validity. Because sometimes if you just go and test only once and come back, that's not enough. Because like I said, things change by the day. We are dealing with human beings with various functions and so on. So sometimes people are happy, sometimes they are not happy. And when they are not happy, they don't give you, they have a different way that they reflect on their feeling to you from when they're happy. And so you have to go several times and be able to find the mean that is more occurring, and that is as close as possible it would be to being valid. There's also access and resource constraints. These are challenges in measuring here. Now, we just talked about several collections, going through collecting data severally to be able to get the mean and value and so on. But what if you don't have the funding to do that? That's a challenge. So limited time, funding, or staff can impact quality and scope of the measurement and activities. You find that those who are going to take census and they do a sample, the smaller your sample size, the more difficult it is to generalize on the public. And so maybe you choose a smaller sample size because of the funding available. Like if you take a National Demographic Health Service, that cost is huge to implement in a country, and a country as big as Nigeria. The cost is huge. So you're talking millions of dollars and billions of naira to survey the whole country. And the more indicators you have, then the higher your sample size and the more expensive it is. But if you don't have the budget and you begin to cut down, then you are not able to generalize your sample size, or your results cannot be generalized to the entire public, the entire country. And so these are challenges that you have. So in social work setting, you may lack the infrastructure for rigorous data collection and analysis, because even social work are usually the least funded. The least funded. We're hoping that that will change. So it is important to identify this and make a determination on how best to collect your data, knowing also. So in other words, you must have to look at your budget, develop a budget, and things first of all. You must have the budget set aside, and then look at that budget and look at your sample and all that, and then decide what you really want to collect, if you really want to have more indicators or less indicators in collecting samples. Another one is challenges in measurements, participant engagement, and response bias. You will agree that there are sometimes you go and people want to give you over information, over impress you. They want to impress you, or may not want to give you information at all. So client may be reluctant to provide truthful responses due to fear of judgment. So you will judge them or mistrust them, or have a misunderstanding, or they may have a misunderstanding of the purpose of the measurement. So how do you address that? There is no one size fits all in this case. So it depends on who you're talking to. It depends on how comfortable you make the client to be. And it depends on the indicators that you want to collect data on. You know. Those things, like if you're counseling people who are divorcing, and they are sent by courts for counseling before they decide to continue or not the divorce, it's always difficult to get information on the real cause of the things. Partly because divorce thing doesn't start immediately and they decide to divorce, but over time. So they may have forgotten some of the things and so on. And so by the time one person says this, the other person says that, and so on. So you end up in a bickering state where things, but you have to find a way to engage, find a way to engage the participants to be able to calm the situation and garner the trust to look at not what costs or what angers each person, but what could have been done to limit the angst that is between them. That makes them more comfortable and look at, so they look at remedying the situation as opposed to complaining about the situation. There's also social desirability bias and non-response can skew results. When even the person the client feels that you are not part of their social or cultural affiliations, they then don't want to be able to give you information because they think that information will paste their or present their culture in a bad light. And so that may skew your results that you're getting. So these are the challenges that you get in engagement and bias response. There are more, so you can research and get some more on those ones. And again, here there are ethical dilemmas in mandatory reporting. Situations may arise where measurement uncovers information requiring mandatory reporting. Example, abuse, self-harm. Now, you didn't go to find this thing, but when you find it, then what do you do? You know, my office at one point developed a plan that when you go to a community and you're doing a community outreach, and you find a child coming to report to you that she's been molested, and that is a very serious issue. You not right there and then take the child and go to the police station to go and report it. Because you're not only endangering the child, but you also endanger yourself going back to that community. So you have to have had a meeting in your group or in your class, or how you deal with that. When you're collecting data and you find that there's a serious issue that has arisen, how do you deal with that? Do you just wake up and say, we have to go and address this? No. First, go ahead and collect the data and finish, but then do a report through your office that this is what you found that requires further investigation, giving specific names and so on of the people, as much information as you elicited from the person. Send that to your office. Let your bosses decide how they go about it. Don't immediately feel that it is your responsibility as a social worker to address that right there, because it has caused a lot of people some challenges in the community. The community may get angry and so on because you do not know the power levels in the community and the person who is either perpetrating the abuse or so on. Again, here we talk about ethical issues, balancing client confidentiality with legal and ethical obligations. It poses significant challenge. There are certain situations that you go and you find out, for example, that the way is coughing in that place, in that community, or that person may have tuberculosis. That person may have tuberculosis. Tuberculosis is a very serious thing and is a very serious public health issue, and there are public health procedures for handling that. You know. So how do you balance the confidentiality of this person that has spoken to you and things with him? Or more so, the fact that the person you're talking to is also being molested and has told you but does not want to come out publicly to say it. And so if you go and report it to your boss and things, that person may deny it. How do you balance that? Because they don't want the community to stigmatize them. And the person may be the village Oba or Bale or Igwe or Chief or Emir. How do you manage that? So you need to consider this ethical dilemma because there is not just one size fits all, like I said earlier. It is certainly very difficult. Use and misuse of data. Measurements data can be used to advocate for clients and improve services, but can also be misused to justify funding cuts or punitive measures. This is a very serious aspect that involves social work and client relationship and programming. When you are developing a program and you give a budget and all that and so on, and you present your data, as I said, remember, every data you present has a negative side. Somebody may choose to use the negative side of that data, negative side of the data, to justify why you shouldn't even be funded or you shouldn't continue with that work. So anytime you're going to do a presentation or we're going to collect data, ask yourself, will this data, is there a possibility that this data can be misused? If it is going to be misused, what can we do to secure it? Is there a way that this data, would this data mean that our program should be cut because we are not providing enough information? The government, somebody in government, see this data and feel that, this data is presenting my community in a very bad light. I cannot accept it. And because of that, I'm not going to approve it. But you don't know that. But the bias of the person involved could be an issue. For example, no community wants to be known as a community that allows for early marriage because it stigmatizes the community not only nationally but globally. So when you collect data on early marriage and you are presenting it, be sure that the sensitivities and things that you presented could be, and somebody may stand up and challenge you and claim that you did not collect the data well, that the people you spoke to, that, and so on. They kind of misrepresent your representation, not because it is wrong, but because it affects their culture or what they perceive as their culture or present their community in a bad light. Social workers must advocate for responsible interpretation and application of data. Remember, you stand on a position of equity. And so when you're developing when you're presenting or collecting data and so on, you must always be sure that it's responsibly interpreted. Because the data can be interpreted in various ways, both inimically affecting the client or helping the client. So it has to be interpreted in a responsible way that shows why. That's why when you're doing a research and things, you write all those things down because that would be what you go back to be sure that the data you're collecting reflects what you have written in the proposal and the way you collected the data. And that the data, when it's being applied to develop policies and things, would be a policy that would be applicable to what the reasons why that information was solicited in the first place. So, general strategies for ethical measurement. What should you do to ensure ethical measurement? You must adopt participatory approach, involving clients and communities in the design and implementation of measurement tools. Remember, your tools are what will help you get the information you require. And so it must be culturally specific and broadly so elicited. The tools must have gone through broad testing, ethically specific and broadly tested. Engage in continual education on ethics every time. Ethics cannot be overemphasized. You must engage in cultural competence and methodological developments. You have to follow those kinds of. It's continuous because you may change it depending on the community you go to because there are different cultural competencies required for certain communities. Collaborate with interdisciplinary teams to enhance the ethical and practical robustness of measurement practices. If you can't go and do a research and it's for you alone, your team alone, you have to look at who has done this before. Let's see which department also is involved in this, and let's collaborate with them to get it done. You will take credit for initiating it, but it's not good to say because you want the credit to be yours alone, you wouldn't collaborate. No, you have problems. Advocate for organizational support and resources to uphold ethical standards in measurement. Your organization must support the fact that you want to uphold ethical standards. An ethical standard is necessary to ensure that your results are nationally and internationally approved because you've taken note of all of these things, and those cost money. So you have to fully resource it, either in personnel or funding. So, closing statements. Ethical considerations and practical challenges are inherent in measurement in social work. By upholding the highest ethical standard and responding thoughtfully to obstacles, social workers can ensure that measurement serves justice, empowerment, and the well-being of those they serve. This should be keywords for managing ethical considerations when you are conducting measurement and evaluation in social work. I have questions. Stop sharing. I have another class, so I have to situate myself. That class starts at, I think, 8 o'clock. So I have to situate myself again before I get onto the class. So, do I have any questions?
No, sir.
David Akande.
Yes, sir.
How are you?
Fine, sir. Good afternoon, sir. Well done,
Good
sir.
afternoon.
Good
Good
afternoon,
morning.
sir.
So, what's your question, thoughts, and things?
Well, for now, sir, I'm still digesting the presentation, sir. So, well,
Okay. You don't have you participated? So I'm trying to get others. Other people should look into and see that it's also whatever I say to David is also to them. Have you been in situations in the course of your work, either in social work or in the office or in the community, where you have faced an ethical dilemma?
well, not really, sir.
Are you sure?
Oh,
Even
yes, sir.
okay. Maybe you have not recognized something to be ethical. But let's see if I have messages. Who has gotten a situation where they had to think about the ethical implications of what they're doing, either at home or in the office or in the community? You can unmute and ask and respond if you have.
Yes,
I
I
see.
think I've had a challenge. When a student was a drug addict,
Okay.
so she was caught smoking hemp.
Okay.
Then we need to relate the issue to the parents. She doesn't want us to speak out. We wanted to help her. So the students, instead of cooperating with us, with the authority, the school authority now, she thought of ending her life, committing suicide.
Okay.
So even the parents, when they got to know of it, they disown her. They leave the student to us. They sent her to come and study in school. They did not send her to come and be smoking hemps. So if she's caught doing anything contrary to the school rules, they have disowned her. I don't know.
So you see the challenge You see the challenge with that, for like the
Yes,
challenge of school policy, the policy of the school, and
sir.
the parents failing, and then the child's. There's a dilemma there. That's ethical dilemma right there.
Okay, sir.
Because the actions taken so far left the girl on her own. And you can understand why she thought of taking her life, which is additional ethical dilemma to the government. Because when you attempt to take your life, that is a crime.
Yes, sir.
So how best could this have been handled? If the school had social workers in them, and they find a girl smoking, the school authority, what the school authority should do, first of all, is to assign that girl to a social worker to find out more information.
Okay.
Why is it? Without just focusing on the Indian hemp that she's smoking. Let's first understand
The
her
background.
household, the house she came from. What is going on? How are her parents? How are the kids? Does she have senior brothers? And so on? What is their life? And so on and so forth. And then, what about her friends in the community? And then, so you find, because she may have been influenced, nobody wakes up and starts smoking Indian hemp. She may have been influenced by those factors around. Maybe she has senior brothers or brothers' friends who smoke it and they give it to her to smoke.
Okay.
Or maybe she has friends around who smoke and they give it to her to smoke. So the social worker would be able to identify all of this, put together a note, and then without having the students sent away out of school immediately, put a note and send to the principal for a review.
Okay.
The principal, and then before the principal, and your note will prescribe what could be done and what are the implications if something is done harshly, like the parents disowning.
Okay.
That's not. And then after that, the social worker will then tell the school, don't act yet. Let me go and speak with the parents of this girl. You see it,
Hmm.
So you're able to speak with the parents instead of the school sending away and reporting to the station and all that. That is a very harsh way of handling a situation like that.
Okay.
And that's what we need. That's why we need professional social workers in school to be able to manage these conditions.
Yes, sir.
You see? So you have those kinds of things, experiences. It happens not only in school, and thank you for raising that, because you have clearly provided an example that we use for this discussion, or this discussion has shown. Ethical implications. You need to collect data from the person. You need to triage this data with the community and friends. And then you need to let the authorities know. And you can prescribe what can be done by the authority, what the authority should do. Because sending someone out of school does not solve the problem of that person. It may have solved the problem for the school that they don't have to deal with that anymore and continue with academics. But what does it say to the child that their future is being destroyed? Exactly. Just for an act of smoking Indian hemp. So we need to consider this fact as social workers as we implement activities. And I'm glad that you raised that. Thank you for raising it.
Thank you, sir.
All right. So, any one more example before we call it a day? And sorry, guys, for not coming. I didn't get the information that the class has been moved, So if I had gotten it, I would have started much earlier.
It's okay, sir.
Yeah. So, like I noted, I'm worried that the names of people I see in here are not There are 5 people, including in the class. 1, 2, 3, 4, 5. Yeah, 5 people in the class. And I see 1, 2, 3, 4, 5. Okay, I see 5, but some of the people I see are not here. Names are not here. It's like Magnus is not in this class anymore. And then, yes, there's Bridget. There's Funke.
I'm in class now.
Yeah, no, Bridget is in class.
Yes.
Who's Bukola? Bukola is not here. And okay. Shadrach. Shadrach. Is it the same Shadrach Esther? Mobaji Shadrach. You can see Shadrach Esther. Mobalaji, can you unmute and let's find out who they are, because I don't have the name of the class list. I just see what was put on the schedule, and that's not everyone. Mobalaji, are you there, or you just muted yourself and left and went somewhere? Okay. All right. We'll see how it goes. So I'll get to the next class. Will be I will send out. If I could get your email and your or WhatsApp group for this class, I will appreciate that, because then I can send out information.
Okay,
Because
I think that will be better.
On the forum on the entire class, it's for everybody where they send out that thing and so on. The notification is for everybody who not in the class and so on. So can somebody volunteer to collect WhatsApp numbers for everybody so I can share the lecture notes and things to you guys via WhatsApp or email?
Okay, sir.
Okay. Thank you, David, for offering. If you can get all those and send to me, because I would be I'll be traveling much of next week. In fact, from middle of this week. So I would like to send notes for the following week to all of you guys so that we can review ahead of time. And the ones we have done, I will send it out across to you too.
Okay, thank you, sir.
Thanks. So send me that, and if you can put it in, send it all, and then I can create a group out of it. Thank you.
Okay, sir. Yes,
And
sir.
have a good day, guys.
Thank you so much,
Bye-bye.
sir. We really enjoyed your
Thank you
presentation,
so
sir.
much, Chief. We really
Thank you.
appreciate you.
Thank you
Thank
so
you.
much.
I
Thank you,
appreciate
sir,
you
for
guys
today.
too.
Thank you for always.
Thank you. Sure.
Thank you for
Bye-bye.
imparting knowledge on us.